Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. I would like for you guys to share this video with family and friends and like the page. I'd like to get this Facebook channel up and running and really big so that people can understand what's going on with their health. So we'll get right into it today. We're going to go into number 3 in terms of causes for fatigue. So the first 2 weeks we did anemia, and then we did sugar dysregulation. Today we're going to talk about GI dysfunction or gastrointestinal issues. Now this topic alone could take probably 3 or 4 weekends full of information to get it correct. But I'm just going to hit on the main points, and you might want to go back a few weeks. And I did do some seminars or some short videos on GI dysfunction, okay? So why does GI dysfunction cause fatigue? One, it's usually malabsorption. So if you have GI dysfunction, you're not absorbing your nutrients correctly. So whether you're taking B vitamins or you're taking iron, if your GI is not working correctly, it's not going to absorb and be utilized at the cell level, okay? So number one cause for GI dysfunction is GERD, or gastroesophageal reflux disease, right? Basically that heartburn or burping, belching after meals, or it feels like this big rock is sitting in your stomach. So with gastrointestinal reflux disease, we're looking at problems with so-called too much acid. So the traditional medical model will be you need to take an antacid, right? Your typical Prilosec, Zantac, Tums. But for the most part, most people do not have too much acid in terms of acid production. They have too much acid because of fermentation of food in our GI tract. Basically, you're not able to digest your foods correctly, therefore it ferments. So the number one cause for really those signs of heartburn is not too much acid in terms of you're producing too much. It's a lack of acids that are breaking down your foods. So oftentimes we give patients additional acids like hydrochloric acid, pancreatic enzyme, digestive enzymes, things that break down the food better, and then those reflux signs go away and they have less need for the antacid medications, okay? So number 2 can be an issue with malabsorption. And malabsorption can be a variety of different issues, but there's a little known marker that patients don't realize they may have, and it's called intrinsic factor antibody. Those patients who have that may not absorb their B12, therefore may require a B12 injection or maybe some liquid forms that absorb before the stomach, into the mucosa. So those patients who have intrinsic factor antibodies in the stomach will not absorb their B12 properly. Malabsorption can be as a result of antibiotic therapy. So if you've been on long courses of antibiotics, had multiple infections, I see these kids that come in, they had multiple ear infections, right? So go antibiotic, 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 and then all of a sudden they develop GI issues, right? The tummy hurts, they bloat, they're not going to the bathroom properly, they get cognitive issues because the gut is connected to the brain, and they're going to have malabsorption. I see it in kids sometimes where they have low-grade iron deficiency because they're not absorbing the nutrients properly. So malabsorption in the fact that you're using antibiotics or antacids can create that. Another reason is buildup of toxins and parasites and those types of things. Those things will damage the gut lining where it breaks down these bonds called zonulin and occludin bonds in the GI tract, and large proteins will start to cross into the bloodstream where it should not be. So intestinal permeability is what's the new word in functional medicine. Intestinal permeability. Basically, things that should not get into our bloodstream is getting into our bloodstream. And intestinal permeability can be due to the antibiotics, antacids, prolonged medication, prolonged steroid therapy, chemotherapy, whatever it is. It could damage the gut lining. Therefore, you're not, one, absorbing your nutrients properly because it's not being broken down, and two, large molecules are crossing into the bloodstream where it has an immune response. So your body attacks these large proteins because it should not be in the bloodstream. It should be broken down in the GI tract for utilization. Another one is something called SIBO. And SIBO is actually one of the leading causes for IBS, or irritable bowel syndrome. And SIBO is when your large intestinal microflora, or microbiome, sneaks into the small intestine. So things that live in your large intestine that's normal will sneak into the small intestine where it overgrows. So these are the patients who basically eat a meal or carbohydrate meal and they feel like they're 4 to 6 months pregnant. They literally will look like they're pregnant because of the meals. And these people who have translocated bacteria that's in the large intestine into the small intestine will have these bloating issues that can go on for many, many months and years sometimes. And those patients need a specialized diet in order to help manage that and then get them back to eating properly. So GI dysfunction will cause fatigue as a result of malabsorption. It creates inflammation. Sometimes it can create an immune response. Therefore, it creates havoc in our generalized system. And one of the biggest places that it'll have an impact is the brain. And then the brain will create additional fatigue, brain inflammation, right? So these types of causes are not often discussed because in our current medical model, we talk about system care, right? You have specialists on the brain, specialists on the GI, specialists on the liver. But all these things work in harmony. They have to work together in order for it to function properly. And one system affects the other. Brain affects gut, gut affects brain. You can't really separate the two. So when you look at gut function, you have to say, do I have GI symptoms and is that causing my fatigue, right? Do I have iron deficiency anemia and is that causing my fatigue, right? Is it blood sugar dysregulation? Is that causing my fatigue, right? So you have to look at the underlying mechanisms of fatigue. So if you want to go back and look at the video on anemias and blood sugar dysregulation over the last 2 weeks, it's a great place to start. Today is part 3, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results. And next week, tune in for part 4 of fatigue, all right? We'll see you on the healthy side. Have a great day.